All right, we're ready to go for our next interview. Joining us via Skype, and this time we go to Germany as we continue to travel the world on this show. And joining us is Kadiali Servista. The name of the book is Maya, M-A-Y-A, Bring Tears of Happiness. Welcome so much for joining us here. What's the book about? Why did you write it? It's published, by the way, by Author House. You can go to authorhouse.com, barnesandnoble.com. What's the book about, and what's the significance of Maya?
Maya is a word, it meant like medical advice you access. People who are sick just rush to a doctor without thinking why, what the doctor is going to do and what they expect out of the doctor. So what happens is, this is a book which educates patients before going to a hospital or seeing a doctor. Medical advice you access. They go into Google, search the symptoms, and then they look at the small print. They don't look at the common conditions. They look at tumors and things like that, and they get panicked. So to prevent that, I've written a book which educates them how doctors derive a diagnosis. That's why it's called Maya. Maya is a word called illusion, a veil of illusion. It's an illusion to believe that doctors can save your life. So it actually demystifies healthcare, and a book helpful for patients all over the world.
What are you a doctor of, sir?
Yeah, I was working in a hospital as a staff doctor in a pediatric intensive care and general pediatrics. This is where all the critical ill people come every time. And I had to diagnose illness very fast. So I have practiced this technique where I can derive a diagnosis very quickly so that I don't do any mistakes. And that is what I'm sharing.
All right. What proportion of people aren't happy with the healthcare system that we currently have?
In America, they're worried about the cost and insurance. In England, National Health Service is completely crumbling up. They don't have staff, and every day there are newses, and they're paying £151 billion on compensation. People are dying. 44,000 people died last year with sepsis, and that is a disgrace to medical profession.
Could you summarize the important problems that you encounter daily as a physician?
That's what I did. In 2003, I started collecting the common symptoms which makes patients anxious to ask the emergency appointment. When I compiled a list of thousands of them, I came to know the symptoms which are very common, like headache, flu, fever, cough, skin rashes, tummy pain, and things like that. And these are the common symptoms which makes people anxious. And what I have done is I have reduced the symptoms of all the diseases into 9 common ones, and based on that, patients can get the advice. That's what I've done.
What can your book do to help people?
Basically, what it does is, if a patient has a symptom, they can go and read up about that symptom, and there are 3 symptoms to choose. If all 3 symptoms are red, that means to say they shouldn't sit and waste their time waiting for the family physician to examine them and tell them what to do. They must go straight to the hospital because that will be an emergency. If there are 2 red symptoms, that means to say they need to be examined, or maybe need a test or a procedure performed to diagnose the condition first. So they must consult the doctor within 24 hours. And 1, you can deal with it by telephone. In England, we have what is known as nurse-led practice, where nurses will help you to diagnose. So green color, they can go to the nurses. They don't need any clinical examination. It's just taking a decision based on the history. That's what I've done.
How would you describe your mission? You also talk about apps to help fight infections.
That's right. This is based
Explain, yeah.
The app is basically, it asks you to put in 3 symptoms. And when you put 3 symptoms, it will show you the color, whether red, green, or yellow, and it gives you all the information what you need to know about these 3 symptoms. And then there is another app for the doctor. The doctor can use the Maya Doctor app and create his own list of symptoms. So I am just trying to set up a group, like a WhatsApp group, in a local area, linking doctors and the patients. This will help me to identify 3 common symptoms so that I can easily pinpoint and say there is an infection epidemic occurring in Ethiopia or somewhere, because the symptoms are identified and you can mark it as infectious diseases. And if a cluster comes, we can quickly identify the place where the infection is start spreading, and we can cordon it off. We don't want Ebola-like infection to spread all over the world before the WHO or the CDC decides what to do. And that is a disaster. If they take 8 months, millions would have died. So that's why my app is very useful to identify the location, hospital, country, state, and even at home. And that's the idea I've released the app for.
Do you have a system to, most of us are confused and anxious because we can't separate serious illness from minor illness, and then it introduces anxiety into the equation. That can be disastrous. How do you approach that?
That's exactly what Maya does. Maya I differentiates between serious and not serious infection. I'll give you an example. If your child has high fever, people always assume, oh, high fever, the child must be really unwell. To tell you frankly, high fever is not what I will worry about. Why? Because virus infections will increase the temperature quite high. Bacteria is like humans. They don't like the temperature to go above 38 degrees. So the temperature usually drops. And based on that, we can differentiate between virus and bacterial infection. Bacterial infection is the one which will kill. Virus infection rarely kills.
Who did you write the book for?
For the patients. For people like you.
Okay.
Absolutely. I'm sorry. Very, very common sense approach. And it's the simplest book you can read. It is cheaper than an encyclopedia. And it gives you precise information what you need to know.
All right, you got delays in consultations, and here we go, anxiety again. People are afraid of the fear of cost, infections, false reassurance. It's a very complex issue that often results in devastating consequences, isn't it?
That's right. I've done a lot of reading and studying for this for almost 12 years. The psychology of a patient who has a serious illness, who has a tumor or a cancer going on, he subconsciously knows that he has a cancer. The reason he comes late to see a doctor is because he doesn't want his diagnosis to be confirmed. A person who has a common illness, which is not serious, is the one who gives me trouble. They want a quick fix treatment. And this is very well known. Why do people with cancer always have a delayed diagnosis? Because the patient doesn't come to the doctor. They want to keep away. Maya demystifies that. It will make you run to a doctor when you have to. And even if it is a common symptom or a serious symptom, it will say, go to the hospital now. And that's all it does. It doesn't give you a diagnosis. It tells you the possibilities, but it will make you go to the hospital, consult a doctor when you need. So wasted consultations are reduced, cost is reduced, patient running around with infectious disease in the train and going to the hospital, giving it to everybody is also reduced. I think we have to stop this habit of just being dependent on a doctor to diagnose an illness.
Do you have a concluding statement you'd like to make, sir?
I would expect my colleagues, doctors, and people to download my apps, link themselves up, create a group, and help themselves. I would like to monitor the infection going around. When it happens, an epidemic happens, we should stop it at bay. And I sincerely hope people use my...
Maya, bring tears of happiness. Dr. Katyali Srivatsa, that is Author House. Thanks so much for joining us from Germany.